A stroke occurs when the brain suddenly stops receiving enough blood. In most cases, a blood vessel becomes blocked. In others, it ruptures and blood enters the surrounding tissue. In both situations, the brain is deprived of oxygen, and within minutes nerve cells begin to die. This makes a stroke one of the most dangerous medical emergencies. Many people first notice only subtle changes: numbness in an arm, difficulty speaking, or sudden dizziness. These early signs are critical, because the faster help arrives, the greater the chance the brain can recover. Modern diagnostics can now determine within minutes what type of stroke is occurring and which treatment is required. Medications can dissolve clots, and specialized procedures can reopen blocked vessels. The first minutes decide how much brain tissue can be saved. That is why recognizing the warning signs and reacting immediately is so important. The early signs of a stroke often seem harmless, yet they are clear warning signals from the brain. A sudden weakness or paralysis on one side of the body is typical, often affecting the arm or the face. The mouth may droop, or an arm can no longer be lifted. Speech problems are among the most important symptoms. Words may not come out, sentences sound unclear, or the person suddenly cannot understand what others are saying. Some people experience a severe, unusual headache that strikes like lightning. Others briefly lose balance or suddenly see double. The key point is that these symptoms appear abruptly. They come without warning, and that makes them so dangerous. In these moments, every minute counts. The faster emergency services are called, the greater the chance the brain can avoid permanent damage. Many people hesitate, hoping the symptoms will pass on their own. But a stroke does not go away by itself. Only immediate medical treatment can prevent further areas of the brain from being harmed. Knowing the warning signs and reacting quickly can save lives, including your own. After the initial medical examination, doctors determine which treatment is most suitable for the patient. In most strokes, a blood clot blocks a vital vessel in the brain. In these cases, a special medication can dissolve the clot and restore blood flow. However, this therapy only works within a very short time window, usually within the first few hours. That is why calling emergency services early is so crucial. For larger blockages, a procedure may be required in which a fine catheter is used to remove the clot directly from the vessel. This method has saved many lives in recent years and prevented severe disabilities. If the stroke is caused by bleeding, the treatment is different. Blood pressure must be stabilized, the bleeding controlled, and in some cases surgery is necessary. In all situations, the faster the brain receives proper blood supply again, the better it can recover. Many patients experience uncertainty after the acute phase, but modern rehabilitation helps them regain speech, movement, and memory step by step. A stroke is a serious event, but with rapid treatment and targeted therapy, many people can return to an independent life. After the acute treatment, the most important phase of recovery begins for many patients: rehabilitation. The brain has a remarkable ability to create new connections and take over tasks that were previously controlled by damaged areas. This process requires time, patience, and targeted training. In early rehabilitation, patients often relearn basic movements, lifting an arm, taking steps, or grasping objects. Speech therapy helps rebuild the ability to form words, understand sentences, and regain lost communication skills. Memory and concentration are also trained, as many people experience difficulties with orientation or sustained attention after a stroke. It is important for family members and caregivers to understand that recovery is not linear. There are good days and difficult days, progress and setbacks. But every small improvement shows that the brain is working and adapting. Modern therapies, digital training tools, and specialized clinics support this process. A stroke changes life, but it does not mean the end of independence or quality of life. With the right support, many patients achieve remarkable progress. A stroke changes not only the body but also the lives of patients and their families. Many people must learn to reorganize their daily routines. Simple tasks like dressing, cooking, or writing can suddenly become difficult. This is where support and understanding become essential. Family members play a crucial role, providing safety, orientation, and motivation. At the same time, they must not underestimate their own emotional and physical strain. They too need breaks, guidance, and sometimes professional assistance. Modern aftercare programs continue to support patients after rehabilitation so that progress is not lost. These include regular check UPS, medication adjustments, and exercises that can be continued at home. Prevention is equally important, lowering blood pressure, controlling blood sugar, managing weight, and quitting smoking all significantly reduce the risk of another stroke. Many patients say that after this event, they live more consciously, take their health more seriously, and set new priorities. A stroke is a major turning point, but it can also become a moment of change toward more awareness, more support, and a new understanding of life. A stroke often strikes without warning, yet many risks develop over years. High blood pressure is the most important factor, as it strains the vessels in the brain and makes them more vulnerable to blockages and bleeding. Elevated blood sugar, as seen in diabetes, also damages vessel walls and significantly increases the risk. Smoking narrows the arteries and promotes clot formation. Excess weight, lack of exercise, and high cholesterol levels intensify these effects. The good news is that many of these risks can be controlled. Even small lifestyle changes can make a big difference. Regular physical activity, a balanced diet, and reducing stress support the cardiovascular system. Medications help stabilize blood pressure, blood sugar, and cholesterol. It is also essential to take warning signs seriously. Brief speech problems, sudden numbness, or dizziness should never be ignored. A stroke is a medical emergency, but it is not unpredictable. Knowing your risks and taking action can significantly reduce the likelihood and give the brain a better chance to stay healthy. Thank you for taking the time to watch this film. Knowledge protects, and modern medicine, supported by artificial intelligence, helps us detect warning signs earlier than ever before. If you found this video helpful, I would appreciate a subscription to my channel Echo of the Times. This way, you won't miss any future films on important health topics. Take good care of yourself, listen to your body, and stay healthy.